overall a take-home lesson that end of the film, the margins of every film are very important, whether it is a bone or a chest or a skeletal survey. So she picked, this is the cortex on the right side, and she picked it nicely that it's destroyed on the left side. And this was actually confirmed on MRI. This was the area here. So it was a lytic lesion here, and it was also visible on, sorry, here,
Yeah.
right here. So it is definitely, this was abnormal. And yeah, so this is the area, right? So the approach was fine. Definitely you will see what it is, the staging workup, from where it is coming, what is the cause. And this patient was, what was this case?
Liver abscess. Yeah.
So you called it a liver abscess, right? Or any other DD?
I was just describing the lesion, then we proceed to the next
So
case. I think liver
what?
abscess. Yeah.
Okay, okay. I'm sorry if I just I was just
No
trying to
problem.
save the time because it
Yeah,
is
sure.
already 12. So what do you think? What other DD could be
Hydrated
important?
cyst
Yes,
because of the
because
internalization. Yeah,
yes, yeah,
and the
because it
Dodge
has
cyst.
exactly. Because so the first should be the hydrated cyst because of these cysts
Okay.
and multiple infolded membranes and also no perihepatic fluid or something. So first would be hydrated, and the liver abscess would be the next second less likely thing. Then the this case, so this was case where you just you described the x-ray, this you described the x-ray so nicely. You described it, you said it could be air fluid level abscess, you said this air is going up, so I'm suspecting a hernia here. So when it came to the imaging of CT scan, again you were brilliant, you did a good job, really good job in the description and everything, and you picked the volvulus. But what you missed one thing which is actually very important, that you did not go to the lung windows.
Oh,
So
yes.
you did not shift it to the lung windows. But again, as a, if I'm not sure what how the exams are going these days, just speak to your colleagues, and if you have to change the windows or so be very careful, and train and practice in a way that you don't forget anything, bone window, lung window, soft tissue windows or anything, because there can be something. And even if the examiners are changing it, they will change it once you ask for it. Until
Okay.
unless you ask for it, they might not show you the window or something. I mean, those who appeared in the recently in the exam, they can share this better. But this was important to, there are some cases where the findings are subtle, so examiners are actually cooperative, they will show you the, they will try to help you. But some cases like this big case with something big on the x-ray in the right hemithorax, they would expect you to say that I would like to see the lung windows. So
Yes.
as a radiologist, so and then you see this, you could have always said that I don't know whether it is leaking from the stomach, there is some concealed perforation which has resulted in this hydropneumothorax or pyonemothorax on the right side. So
Oh,
actually, in the real scenario, no one was able to tell that whether there is active perforation in the stomach or not there. So they have given the contrast, the oral contrast, through the esophagus in the stomach, and they try to see whether the contrast is coming to this cavity or not. But it was actually not dribbling in. So whatever it was, maybe it was a separate pathology, or maybe something happened. But the anything which this minor leak or whatever, but it got concealed. And now currently when CT was done, there was no active leakage. So this was, and there
okay.
was chest tube as well, because it was draining this collection in the right hemithorax. So I think this was the case, this was very subtle, but it was there. So if you remember the previous case, there were no diverticuli at all. But
Yeah.
if you see this case, now you can see
Yeah.
this is the diverticulum, and
Yes.
these ligaments are slightly thick here. So this was definitely diverticulous. I don't have his follow-up CT, but this actually progressed further and worsened. So this actually got for there are some air specs as well. If you change it, I will try to show you. I'm not sure if they're visible or not, but no, not air specs, no. But this here is outside, and this is bulging outside, and this is reaction. But this was very subtle. They don't show you cases like this, but a little more prominent than this. This just look at this, the wall of the colon, and look at this balloon like structure, a tiny balloon like structure, central layer with this thick ligament. So this was the left sided pain was because of this. So I don't count this as a miss, so just forget about this case. But the lung window one was very important, I think. From
Yeah.
this was not your case? No.
No.
Okay, all right. So just try to have a look. So please use the link below for feedback. Physial rupture, there was something, but it got healed. So biliary cystadenoma, no biliary cystadenoma for the liver. It was hydrated cyst. Are on outdate Exams are on outdate. Oh, this is for FCPS.